Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel and welcome to what's now becoming Friday's return of Q&A. This is the place where you send me your direct and specific question or questions. That's right, more than one is more than welcome. And I put them all in Q&A folder, and every Friday I select 5 random questions and then I answer them, and I go through the folder until every question gets answered. So if you want to participate, please write to my email. Email is in the description box below, and just make sure you try to keep your question relatively short. If it's too long, don't worry, I will email you back asking you to rewrite it. And I will go ahead and include it in Q&A. As always, the names and information is blacked out for privacy reasons, and I put down timestamps below. Having said that, for those of my viewers who are super observant and wondering where the heck is my tree that covers up the door that I can't stand, or additional plants, I'm traveling to take care of my mom during her eye surgery. So they're in a living room where I have irrigation system set up so they can get nutrients while I'm away. So in case if you're wondering, because I know some of my viewers are very observant of my surroundings and my environment. So these are some amazing questions this week. Some of them are really interesting. Some of them I don't think anybody has ever asked me before, so I'm really excited to get started. Question number 1. I came out as non-binary about a year ago, which my partner was able to accept. But as I've grown into a fuller understanding of myself as a trans woman, things have become more difficult. We agreed to pause things while dealing with other stresses, which are easing now, but I'm scared to bring it up again. I want to continue my transition and live more fully, and I'm afraid it could create conflict or distance. Do you have any advice for navigating this kind of shift in identity when a partner was okay with softer version of queerness but struggles with my trans femme self? This is a great question, and it's a great question because so many people tend to step into non-binary identity as a stepping stone toward their further embodiment of their selves. And this happens for numerous reasons, but 2 most common reasons why this tends to happen is, number 1, you may still not really be sure if you're fully trans-binary, and so you're just moving, you're exploring and you're moving that goalpost as you go along, and non-binary may feel like it offers you enough branching out from your assigned gender. And then as you explore, you may, as this person did, find out that you're actually trans femme and you're moving more toward the end of a spectrum. Another reason why this tends to happen is because for some people socially, this is just very comfortable to first step into gender fluid or non-binary identity and then navigate further and branch out further. And for some people, gender identity, this is going to be the third option, just naturally shifts. I think we're all being inaccurately sold an idea that our gender is innate, meaning it is fixed and stable throughout our life development. Just like some of us erroneously believe that sexuality is the same way. In reality, sexuality for a lot of people does fluctuate and shift throughout their development. The same thing with gender. For some people, they may identify more binary in their younger years, and as they continue to move through their lifetime, it may shift to a much more non-binary, much more fluid, or just a different dimension of gender. So don't forget that. So when this happens, and this happens, I see this quite a bit, because I see partners being just more inclined and more comfortable with in the middle type of gender identities, because they feel that they can still hold on and retain to physical aspects of you that they initially got attracted to, they initially got attached to. Partners also will carry a fear of you changing, just like you may have your own fear of changing as well. So this is very natural and normal, that partner would be okay with non-binary identity, but the minute you step outside of it, that would be a reaching limit for that. In that case, this is just like any other relationship where a partner is not fully comfortable with your whole overall presentation of self. And just like any other relationship, this gives you an opportunity to ask yourself what's important to you. And only you can decide. Some people say what's important to them is forego, put on hold, put aside their fully embodiment and living out their identity just so they can stay in a relationship. Some people say their well-being is more important. You're right now at a crossroads, my friend, where you have to make that decision, and it is not an easy one, but you have to make a decision what's important to you. It's also an opportunity here for you and partner to explore further their resistance. Is there a possibility that they could they potentially give a little bit more time to navigate things with you so that they can see if they can evolve along with you. But yeah, this is not easy. You just ultimately are currently at a crossroads where you have to decide. Your partner also has to decide. They're equally at a crossroads where they have to decide whether staying with somebody that's trans femme identified is going to be for them or going to work out for them. And a lot of times, most couples, in my opinion, don't really fully can know that until they at least go through experience together to some extent. A lot of times I see couples make a mistake to end things quickly, perhaps even quicker than they need to be ended without giving it a chance to evolve. So keep that all in mind. Great question. And I always say some chapters in relationships have to close, no matter how painful, how hard they are, so that other chapters can open up. But great question. And I just noticed for some reason, I think it's because it's overcast in LA today, I'm getting this big glare in my glasses from camera. So if that drives anybody nuts, just look away and listen to me. Question number 2. Hi, Dr. Z. I'm 27 in a gender crisis that ignited 7 months ago. I frequently feminize alone with makeup, clothing, and voice training. I feel a time pressure to begin hormones for better results, but still unsure if it is genuine trans femme identity. Instead of answering, am I trans? What about focusing on the practical aspects of hormones? Do I want breasts? How will the changes interact with my other desires? What are your thoughts on this approach? This is another really, really good question, right? If you are exploring things and you just became aware of any kind of incongruency with your identity, and there's like a time pressure you feel, right, to start hormones because maybe you're afraid you may waste time, maybe you're afraid that you may regret not starting it sooner to get all those feminizing results, but you're still not fully sure if trans femme is identity. Can you then just focus on outcome of the hormones and asking yourself if that outcome is suitable for your identity as a way to find things out? I would say yes. I think that's actually, but in a lot of ways, that's what I encourage people to do. Not only focus on do you know for sure, with for sure and 100% certainty, seldom people experience anyway, but what is it, asking yourself broader question. What is it about those feminizing attributes that you may get on hormones that you feel identified with? What about those feminizing attributes that you feel are bringing you more in alignment with your gender? Alternatively, also split that and ask yourself, what is it about your assigned gender that right now in your crisis that you're not feeling comfortable with? I think it's important to play devil's advocates with ourselves, especially when we experience gender crisis or our egg cracks without any kind of ongoing history of gender dysphoria, which is not a prerequisite, by the way, by any means. But it is very common for people to experience an awareness later in life. And when you don't have any history at all, no onset of gender dysphoria in childhood, this is where your mind starts to mess with you, asking you, how can you be sure if you never had A, B, C, D type of experiences? So I do think it is important, and I do recommend this to anybody, and this is, I play advocate with my clients as well, where I encourage them to ask themselves those questions, like, what happened to you're 27, 7 months ago this happened for you? Was there something happening in your environment? Did something were there any drastic shifts? Did some kind of maybe history of something emerged? Why suddenly now this crisis came to surface? And for some people it came to surface because, you know what, you could not repress it any longer, you could not be in denial any longer. And for some people, I apologize for that, let me put it on mute. And for some people it may come up for some other reasons. So it's very, I think it's very natural and very healthy to play the devil advocate in this case. So I would ask yourself that, what is it about your assigned genders that makes you feel also uncomfortable? What is it about this feminizing effects? Also be very realistic with yourself. Which feminizing effects you think you're going to get, and how you're going to feel if you don't get those feminizing effects. What if you don't get them soon enough? I think asking all of this and probing much deeper is really, really important in this case. Another thing is, it's very common to feel pressure to start hormones. It's very common to have that pressure arise out of fear of missing out, fear of not doing things enough, fear of not doing fast enough. I think it's important to acknowledge you have this fear and not allow yourself to be dictated, to have your future actions to be dictated by this fear. Because in reality, even if you give yourself 6 months to a year to continue to exploring until you feel some sense of more assurance within yourself, that is not a long time. That is not a long time. And I always say hormones are very good for affirming what we already know within ourselves. And hormones can also be, and I should do a video about it, to some extent, because hormones, feminizing hormones are kind of, I always say this feel-good hormone, it can also be a little bit misleading for somebody who is fully uncertain. So sit with all of this, see if you can give yourself a little bit more time and just dig deeper. But I do think asking these questions, do I want breasts? How will changes interact with my other desires? What is it about embodying a woman? What is it about embodying and navigating a life as a woman that aligns with me? All of these questions are going to be very helpful and going to help you dive deeper and deeper into yourself. But very, very good question. And yes, I think this is, it's equally, there's no wrong questions to ask yourself. I think all of these questions, am I trans? And what benefits will hormones give me, are all valid and important question to ask yourself as you go through this exploration. Very good question. Question number 3. Is it possible that as a trans woman presenting very masculine and doing zero feminizing efforts, example, bearded, bald, no makeup, no feminine dress, no hormones, no surgeries, is my authentic self? I told you, there's such a great question today from all of you, and I really appreciate everybody who are submitted and keeps submitting your questions, because it enriches the dialogue within all of us. It really broadens all of your understanding of gender and individual issues, because chances are somebody else's question is something you're struggling with. This is a great question. Is it possible that as a trans woman presenting, so in other words, without doing any, and this is a description clearly of all of the stereotypical physical attributes we equate to a woman, right? Which is nothing wrong with that. We do have to acknowledge we live in a culture and in society where those instead of stereotypes, I like to use language, those gender markers that are culturally and socially have been enforced. They still exist, and they're important to acknowledge. The reality is that when we grow up in the world, not only is our creation of our relationship to our gender gets solidified from within, innate feeling, how we feel about ourselves, how we feel about our gender, but also in relationship to our subjective experiences we immersed in. And those experiences don't exist in a vacuum. We're not living off grid somewhere, you know, in a forest, completely devoid from human culture and human connectivity. And so all of these cultural gender markers, all of these culturally inundated gender ideas of what a woman is, how a woman should look, how a woman should behave, how a woman should carry herself, what a woman should do for a living, how she should speak, all of these shoulds are still become one way a part of your inner landscape. The key always is to figure out for yourself which one, even of those social cultural markers, still feel aligned, and which one feel like you are superimposing on yourself because you think that's the only way to be a woman, that's the only acceptable way to be a woman. And also have room to create a pathway for emergence of your own idea of what womanhood is to you, even if that idea is maybe new, even if that idea maybe is going to be misunderstood. If you are able to do that and not be affected by people not really getting it, I say go for it. So this question goes in line with that, right? To what extent this could be your authentic self? Could you possibly be a trans woman? Could you possibly be a woman without doing all of these physical things? And not only without doing all of this, but could it be that this is the idea of a woman that you embody, right? A woman that does have facial hair, a woman that doesn't have any hair, that is bald, a woman that doesn't wear makeup, a woman that doesn't dress in a feminine attire, is not on feminizing hormones, does not have surgery. My answer is undeniably, of course, yes, you can. Why not? And I know that this might be a controversial answer. And it is controversial because I know that there are a lot of trans women. I work with tons of them. I love you all. I know that a lot of my viewers are trans women who identify strongly with a previous lexicon utilizing word transsexual, where even to a lot of you who are watching, you feel that trans woman implies being disaligned with your assigned male gender, where you go to an extent to really reach that binary end of spectrum, not only in presentation, but also in physicality as much as it is accessible to you. And so for a lot of trans women who see themselves this way, it is not only difficult to understand that this could be a separate and also different and its own unique idea of a woman, but a lot of times, well, let's not fool ourselves. A lot of times it also can feel hurtful because society tends to mock idea of trans womanhood, an idea of trans woman, and media by specifically constantly giving messages that a trans woman is a man in a dress, is a man who's trying to look like a woman but will always be a man, and utilizes a lot of images and a lot of footages of trans women who genuinely struggle to even get access to services and do not pass. So society puts this passing as the ultimate thing. And so for a lot of individuals I work with, they feel like an alternative idea of a woman is hurtful to them. I am of a different opinion. We all have opinions. Just because I specialize in this, believe me when I say that my opinions are just my opinions. I'm not giving you a clinical, knowledgeable, 20-year 20-year sharing on my understanding of gender dysphoria, right? That's a more expert opinion. When it comes to woman and womanhood, I think we all have an opinion. So this is just an opinion. It's just my opinion. In my opinion, we as society have barely scratched the surface of our understanding of gender. We're so stuck, and we're so stuck with bombardment of idea of what gender is in our head. Even those of us who are queer, who are gender fluid, who are gender diverse, who are gender nonconforming, who are non-binary, still struggle with this because we're constantly inundated by binary, only man/woman polarizing messages of being. And so while some of us try to push against this, we can't help but also become aware that we're incorporating a lot of it, and a lot of it becomes our sense of self. So I am of an opinion that a woman, all of these ideas of a woman, hair, makeup, clothing, are just clusters of ideas, of one idea, of one presentation of a woman. I also want to remind all of you, and I want to remind this viewer who posted this question, that there is a lot of cis women who have facial hair, a lot of cis women who are bald, either by choice or maybe appellation. There's a lot of cis women who don't wear makeup, a lot of cis women who are just kind of have very, what we would call tomboyish masculine presentation. Do you think those women are not considering themselves as women? Chances are a lot of them are. So it's really important to be true to not only what your internal gender is. In this case, if it is a woman, you're a woman, but then also to how you want to externalize it. And if for you that is, being all of those attributes you presented, then that there is to it. Now, I gotta say, again, you exist in a world where we're bombarded by gender markers. And chances are, identifying as a woman and presenting counter to inundated gender markers is going to put you in a position where a lot of people are not going to get it, which happening to a lot of people who are breaking through gender stereotypes, gender markers. A lot of people don't get non-binary identities for the exact same reason. So just be aware of that. I mean, this is just the reality we live in. But does that, presenting this way, does it in any way make you less a woman? Of course not. Of course not. Also, let's not forget this goes hand in hand for so many individuals who identified as women before they started on any transition services, right? So all those years people are living with gender dysphoria and not able to do anything about it. Does it mean that their womanhood doesn't start until they present? Of course not. That's ridiculous. Even the notion of that is silly, right? So I say that yes, this could be definitely your authentic self. It's for you to further explore to what extent it is your authentic self. And just be aware that, if you're going to be presenting in gender marker cluster way where people perceive you as a man, because this is where we're culturally at right now, but you identify as a woman and there's going to be a pushback, just recognize that this is what it is. The pushback does not mean you have to bend and you have to modify yourself, unless for personal reasons or otherwise it's very difficult for you to continue living as your authentic self. Anytime any of us branch out from the norm, there's always pushback, no matter what you do. It's just pushback in our families, there's pushback in our communities, there's pushback in our professions, always. That just, people like buck stops. It's like, do not tell my brain that this could be a different presentation of a woman. No. Give me a Kardashian. The reality is that, no. And I think when we try to mold ourselves to gender markers, we inevitably end up putting on a mask. And this time it's a different mask. Yes, it's a mask of this, a cluster of stereotypes. But if those stereotypes don't resonate with you, still a mask. Very, very good question. Oh, this is great Q&A today. I'm loving it. Question number 4. I am assigned female at birth, but I want to be in a gay relationship with a boy. Does having sexual romantic fantasies exclusively of being a different gender mean you might be trans? Or is this just a fetish and a bad thing? I only feel a little gender dysphoria in other areas of my life, so I'm worried I'm exaggerating cisgender dysphoria so that I don't have to feel guilty about a harmful fetish. Very good question. This reads like there's quite a bit of shame here about your sexual preference. Um, Sexual desires and preferences are very diverse, and everybody has very different sexual desires and preferences. Just like I say, assigned male at birth who cross-dress for sexual pleasure and enjoy wearing feminine clothes and get erotic urges from that is normal. It is normal. There's so many sexual practices that are normal, healthy, consensual, that are not being normalized in today's culture. Again, because we are very, very, very hetero kind of polarizing even when it comes to sexuality. So I just want first to tell you that as assigned female at birth, but part of your sexual internal script is a desire to be in a sexual relationship with a gay boy, a gay guy, where I presume maybe you imagining yourself being a guy or being gay yourself. There's nothing wrong with that. Could it mean that your sexual fantasies, your sexual landscape are somehow tied to trans identity? Yes, it could. And that's something that will need a deeper exploration. It is not very clear cut. It also could be that your sexual fantasies are just that, sexual fantasies. I think here's an opportunity here for you to go much deeper and to ask yourself, what is it about the sexual fantasy, the landscape of your sexual fantasy that are appealing to you? What is it about it that tends to feel very connected to your erotomized desires? What is it about this fantasy where maybe if you are imagining yourself as a boy also or a man in relationship with another man that appeals to you? Could your sexuality be telling you something? Pay attention to your day-to-day interactions in regards to your assigned female gender. How does that gender sit and resonates with you? What about that gender and the gender identities that may not feel not aligned? As I said, gender is very, very complex, and I feel like this might be a young adult issue where you're still exploring not only your sexuality but your gender, and I would recommend just to explore more, dive deeper into it, and try to also work on what is it about it that making you feel shameful. Are the sexual desires generate so much discomfort or shame in you? Anytime we have behaviors that are shameful but really shouldn't feel shameful, it will cultivate a lot of resistances, and it will block passageways to self-exploration. So I really encourage for you to explore this more and just pay attention. Like you said, you're experiencing very little dysphoria otherwise. Pay attention to that too. See what's going to develop, and explore. I'm worried I'm exaggerating cisgender dysphoria so that I don't have to feel guilty about harmful fetish. Again, even the words you use, I really encourage for you to explore your sexuality, explore all of the things. Sexuality is, and I think we seldom talk about this, how sexuality is such a personal, intimate, innovative theater, right? It's such a personal, intimate performance for so many people. In the very least, I think a lot of people want sex to be more performative. but they're afraid to go there. And what I mean by that is that sexuality is such a playful act that really enables us to loosen up, to drop this controlling persona we put on front, right? This I got to be proper in a way that I come across to everybody else. And the reason why it allows us to drop all of that and to just drop into ourselves is because it's intimate and it's behind closed doors and it is private. You're allowed to be vulnerable. So I think there's so much performative things to sexuality that a lot of us really should go and explore even further and see what it tells us about ourselves and what it tells us about our personality. There's a lot of people who have sexual kink preferences that are very broad. Some people, for example, really enjoy tremendous amount of submissiveness during sexuality, but then in their everyday living, they're quite opposite. So it's almost like enables them to have that part of them come out in a way where it is personal, it is private, and it feels safe. So I really encourage people to explore because sexuality is such an important component in our lives. And I think that a lot of us just shy away because we're so quick to enabling our sexual preferences. We're so quick to judge that oh my God, if I like bondage and rope, and if I like to be spanked, or if I like to wear latex during sexual act, or if I like to wear a particular personified self, or if I have fantasy where I want to have a sex with a gay boy, something is wrong with me, this is harmful, this is sick, I really need to only desire opposite sex, and I only need to desire to have vanilla sex. I don't think so. This is again my opinion. I don't think so. I think this is how a lot of inappropriate, non-consensual, abusive power dynamic shifts start to take place because people repress their sexual instincts and are unable to externalize it in a healthy, consensual, non-harmful ways. So explore, explore, explore. Did I go a little bit on a tangent there? I had I don't know how many people know this, but when I was getting my master's degree, I also went to University of Michigan and I got a certification degree in human sexuality. Sexuality was also of a deep interest to me. So I always had this open mind about sexuality and just had this innate feeling that as humans we're so much more. Freud actually wrote about it too in 3 essays on human sexuality, about pretty much all of this, how erotomized we are and how there's nothing wrong with that. So gotta give it to Freud. Okay, question number 5, final question for today. I'm married with 2 kids, age 11 and 13. My wife knows about my dysphoria and is fine with my feminizing in private as long as kids don't see it. She also doesn't want me to engage in any hormone or gender services till they are 18. Do you have any advice on how I can navigate this while struggling with dysphoria? This is another really good question. Because I had this scenario come up more than once in working with individuals. This is very common, where partner knows, okay, with you doing certain things, not okay doing other things, kids are involved, and so there is this consensus or agreement, not gonna do anything until they are 18. This is a tough situation. It's a tough situation because waiting till they're 18, in this individual's case, that's in a very least 5 years, in the very most 7 years. That's a long time to prolong living with dysphoria. And if your partner is okay with you feminizing in private, the more you feminize, the more the urge to embrace and to step into your full authentic self might start taking place. That's also a possibility. How do you navigate this? I personally do encourage for people to actually realize, and I oftentimes the client I'm working with, I will meet their partner, have a few sessions with their partner as well, to have not only bigger understanding of their fears and their concerns, but what is behind their decision on this. A lot of times, partners have a very fearful backdrop that if you are going to come out to kids, kids are going to be bullied at school, kids are not going to be able to handle it. It's this a lot of times comes from a fear of somehow affecting kids. In my experience personally, is that kids are incredibly adaptable, incredibly adaptable. We also have to remember that kids today are growing up in a world where they are being exposed to gender diversity way more than ever before. And so as a result, a lot of kids are much more, they're much more fluid already in understanding of gender. And I encourage, when I work with clients, I encourage both partners. The question that I pose to them is, I want you to think what the 5 and 7 years might take away from the family dynamic and might take away from the kids, in a sense of partners struggling with dysphoria. When we struggle with dysphoria, and if dysphoria tends to continue to go up with every year passing, there is a tendency not to be fully present. There's the tendency not to be fully present again comes to mind, because dissociation happens a lot. But even apart from dissociation, so much of your mind headspace is occupied with dysphoria. And so it's really hard to fully be present and fully to be engaged when you are constantly thinking about solving this problem, or constantly thinking about alleviating gender dysphoria, or constantly thinking about what can you do about it. And so I encourage partners to think about that. How much can it add to the family? How much can it add for not only for you to be happier and in a better health space, but how much could it also add to the partner? How much could it add to the kids? How adaptable kids are, how it is actually might be a really an amazing experience for kids to witness their parent go through transition at this age, and to be able to also to have this experience of learnings that life big transitions and shifts happen, and that people move and go through those shifts. The important message sending kids of living life authentically. So encourage partners to think about all the things that it could actually add. Now, of course, there are cases when partners are very adamant, and it is a very strong foot down that absolutely you're not coming out, this is not happening. In those cases, it becomes difficult compromise, and you have to ask yourself, can you continue to endure dysphoria? What can you do? What healthy coping can you incorporate if you're going to decide to continue until kids are 18? Could it be individual therapy so you can have that support on the side? Could it be that you discuss other coping way of expressing yourself more genuinely without fully being completely out? Could you seek out a support group? Could you maybe potentially discuss the possibility of low dose hormones to alleviate dysphoria with your partner without really having any big changes where it is so obvious to the children? So then it becomes discussion of that. But first, I encourage people to think about what could it add, you being your authentic self. But this is hard. And one of the misconceptions I hear most of the time is people believing that coming out is going to people believing that if one parent is transgender, then the other kid is going to now suddenly turn or become transgender, which is absolutely not true. If kids are young, I've seen kids where they're so young, they may mimic, right? I've seen little boys where a parent is transitioning openly within the scope of family. I've seen little boys who are like, Daddy, I want to be like you. Can I also try makeup on? Can I wear a skirt? Kids are exploratory, right? The gender band, and they're leaning toward gender bending because they're curious. that curiosity is not going to turn a kid into carrying trans identity. Trans identity sips far, far deeper than a kid gender bending for fun. I mean, what kid didn't gender bend for Halloween or for other occasions? I think a lot of them do. And they grow up feeling very congruent with their assigned gender. So I think this fear is really silly, because the reality is that kids are gonna and continue to be exposed to gender diversity. And just seeing a trans person in a movie or on social media is not suddenly going to turn them into trans kids themselves. It's the most ridiculous linkage people making. The second thing that I see that is very misguiding is people are afraid that somehow kids are not going to be able to handle it, they're going to fall apart, they're going to be traumatized by a parent transitioning, which is also not true. Kids are resilient. 11 and 13 especially, probably very close, if not already going through puberty. I don't know the gender of your kids. And 11, 13, such autonomous age. This is usually, especially 13, this is the age where the kid is like, I don't care what parents do, don't talk to me. I'm busy discovering myself and my own sense of autonomy, and they're so wrapped up in their world. This is the developmental stage for them. So there's so much misconceptions, but yeah, just do think if you can have conversation about what it's going to add versus take away from relationship with your partner. And then if it's absolute no, and if you don't make decisions to stay in a relationship and not come out until kids are 18, start thinking about healthy coping ways to manage when anxiety really spikes up for you, when it becomes really unbearable. These are all great questions. Did I tell you these are all going to be great questions? They're all really, really good. I really appreciate and thank everybody who submitted their questions and submitted especially things that are vulnerable nature. Encourage, if you do have a question or questions, no matter how simple it may sound, remember, you may think it's a very simple question, but millions of people might be having same questions on their minds. These Q&As are such a great way to hear what people also might struggle with, because that way it makes you realize that what you struggle with is not weird or nuanced or strange or bizarre, that this is there's other people who kind of think and question the same way, or are stuck in the same type of position, or in the same type of or in a relationship with this type of dynamics. So do submit your questions. Again, my email is in the description box. You can also grab my email off my website. Thank you everybody again for submitting, and I will see you in the next video where my plans will be back. Bye.